Hi guys, Dr. Gillard here. Let's teach you how to percuss the abdomen today. Now make sure that you read or watch the video I did because there is about a half-hour lecture that precedes this video. So it would behoove you and you would get more out of this if you listen to that and then come back and then see how I do this. Okay? First one is just general percussion of the abdomen. Why are we doing this? We're trying to make sure that most of the abdomen has a tympanic sound. It won't be 100% tympanic. It shouldn't be all puffy either, like it's full of gas with obstruction or some type of infection. So most of the abdomen the percussion note should be tympanic. All right, there's a couple ways to do this. Actually, the board books, Seidel and Bates, they don't really describe exactly how to do this. Jarvis just has you go kind of in a zigzag pattern. I really like the idea of going up, and we know the quadrants, right? We have the right lower quadrant, left lower quadrant, left upper quadrant, left or the right upper quadrant. So I like the idea of going like this. And remember when you percuss, you're supposed to keep your fingers together like this. 1, 2. 1, 2. Go back to the first video we did for that. I'm going to just go like this so maybe you can see what I'm doing a little bit better. Okay, so to percuss the abdomen, you just start 1, 2. You go up in a straight line. And then I like to come across. Make sure you go all the way out here. Why do I like this pattern? Because people with hepatitis or any kind of cirrhosis, it may cause some fluid in the peritoneal cavity, and it might deposit over here in the flank region. So it would go dull there. So if you just go straight up like this, you're not palpating or you're not percussing the place where you might get an accumulation of ascites. Okay, so that's the way to do it. So in the examination, I'm going to say percuss I'll pick a quadrant, percuss the right lower quadrant, and all you do is go 1, 2, up, and then start in the midline, come over. That quadrant's done. Okay, if I say right upper quadrant, same thing. Remember the line is right there at the umbilicus, so go up. This is exactly how we're going to check for the liver boundaries, the inferior border of the liver as well. And then come across. Okay, next one. That would be the spleen. If the spleen was enlarged, that's where you would hear that one. Go across. Okay, etc. I won't do the last one. You got the idea. Okay, so that's just general percussion. We're checking for the percussion note for normal sounds of the abdomen, which are, again, not resonant, tympanic. Tympanic. All right. The next task you might get asked to do is to check the abdomen for ascites more specifically. If I say just generally percuss the abdomen, you'll do what I just did. If I say check for ascites via percussion, you're going to look for a region of horseshoe dullness. All right, so you will start just like the spokes of the wheel and the belly button is the hub. So you're going to percuss straight out. Let's pretend that I hear dullness right there. I will take my marking pencil or my dry eraser or whatever skin marker that you want. I'm not going to do that in her, but I would mark it there because that's unusual. We should be able to go all the way over. Then I'm going to go this way, just like the spokes of a bike. Okay, let's say I hit it again, and then again. Oh, dullness right there. I mark it again, and I keep going. And if they really have ascites, mark it again, there's dullness. You will start to draw a horseshoe or a smiley face with the nose in the middle. Yet when I go straight up, If she has ascites, it'll be tympanic all the way up. It'll be all the way up to the xiphoid process because the peritoneal fluid only flows over to the flank area here. All right, so that's assessing ascites, looking for that horseshoe pattern. All right, so we got that one checked off. Let's check the liver span. I might say, okay, I want you to check the liver span on this patient. So to check the liver span, we have to find the inferior border of the liver and then the superior border of the liver. All right, so to find the superior, as I explained in my lecture, I won't go over that again, but to find the superior border, we have to work in the mid-clavicular line. So that would come down about like this. We're going to start here and right at the kind of between the right lower and right upper quadrant, and I'm going to percuss straight up. What's this called again right here? Good, costal margin. Costal margin. So it's going to be tympanic, 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 dull once I hit the costal margin. Now, I might hit the liver, which is, the law says that it can extend down no more than 3 centimeters, right? So just a little bit more than an inch. So if I do hit dullness right before the costal margin, that's okay, that's normal. Most of the time, the books say only 50% of the time you can even percuss or even palpate a liver. So you're probably going to be tympanic all the way up in most cases. But I might say in the exam, assess the lower border of the liver. I want to know if the lower border of the liver percusses normally. So you would go down here and come straight up. Thud right there. That's her costal margin. So great. So she doesn't have a big liver. It's not going, way down here. So that's great. I explained in the lecture why you don't come down, because this is a resonant note in the chest that's very close to tympanic, or that's very close to dullness. Tympany and dullness are as far apart as you can get, so you got a better chance of picking up that dullness if you're going from tympanic searching for dullness, as opposed to searching from resonance to dullness. All right? So that is the lower border of the liver. The upper border of the liver, we have to, because she is a female, so could you please put your hand over your breast tissue, just this side, and pull it toward your shoulder slightly with your fingers like this. And we're going to percuss down the mid-clavicular line. She didn't turn off her phone. When you get, so this is going to be resonant, resonant, resonant. When you get to the 5th intercostal space, you're going to hit dullness. That's a normal liver border. So anywhere from at the most 3 centimeters below the costal margin to the 5th intercostal space. In fact, and you can mark that if you're asked to do that, and then you can get a tape measure and measure the liver span. And the liver span, of course, what's the magic number? 9. So it's on average, it's 9 centimeters. Should never be greater than, what's the greatest it should be? 9 and 6 is 15. What's the smallest it should be? 6. Okay, so that's the liver span test. Now I might ask you to check, let's say she has horseshoe dullness. So we think maybe she has ascites. So what we're going to do is have her do a karate chop. So just go ahead and put this one here. And you're going to do like a karate chop, but bend your wrist and push down. Okay, so if there's adipose tissue, and because I'm going to send a shock wave right here. And if she doesn't do this, because fat has a high water content, the sound wave I create here will go right through, and I'll be able to feel it over here. So it's very important they push down and kind of block any adipose tissue. Now, if she does have ascites, and I do this, by the way, this is called the fluid wave test. Okay, as I was saying, so if you can have her put a karate chop down there, that will stop any transmission of fluid through the fat tissue itself. If she really has ascites, and I do this, So this hand is kind of, I'm just placing it over here to feel with my finger pads here. And if I tap like this, almost like you're percussing, I feel nothing. But in someone with ascites, the water fluid would transmit that sound and I would feel it bounce off my fingers here. Okay, so that's called the fluid wave test. Okay, there is one more test that we can do. So for ascites, so if we percussed over here and we thought we heard dullness and we really wanted to check this, okay, it's really dull, I think it's fluid. What we could have her do is, could you roll toward me, please, on the shoulder? Just roll on your side. Okay, now we got her in this position, so all we would do is repercuss. Don't hit the ribs, those are going to be dull, but this area that was dull is now tympanic. So that proves that the fluid has moved down. Thank you, you can go back to your other side. So that just proves that that was fluid.